While the possibility of a coronavirus infection after vaccinated is rare, it does happen. However, the number of people contracting COVID-19 after getting their full dose is rising. News 8's medical reporter Dr. Mary Gillis spoke with one doctor who says there's no reason to be concerned. Mary.
Thanks, Phil. They are called breakthrough cases. The CDC defines it as the detection of a coronavirus antigen in a respiratory specimen collected from a person more than 14 days after they completed all recommended vaccine doses authorized by the FDA. While this may strike fear in some, Dr. Ramuletti, Chief Physician Executive at Community Health Network, says it's to be expected. The medical community needs to reframe the barometer of vaccine success, not in terms of breakthrough cases, but in terms of something else.
We need to say when breakthrough hospitalizations, not breakthrough infections. And that's the issue. Again, if I have 180 people in my hospital with COVID, 5 are vaccinated and 175 are not. So we need to think about not breakthrough infections, but breakthrough hospitalizations and breakthrough deaths.
No vaccine is perfect. Uletti adds, at best, he says, we can expect the flu vaccine to be 55% effective from year to year. Evidence shows coronavirus vaccines range, depending on the shot, are up to 94% effective. To date, there have been approximately 13,000 breakthrough cases. Of those cases, 0.008% were either hospitalizations or deaths. Reporting from the studio, I'm Wish TV News 8's medical reporter, Dr. Mary Gillis.
Mary, thank you. It's also flu shot season, and health experts are giving advice for when you should get your shot. Presidential advisor Dr. Anthony Fauci says it's okay to pair it with the COVID-19 shot or booster dose if you're eligible.
What you should do is get it as soon as you can and in the most expeditious manner. If that means going in and getting the flu shot in one arm, the COVID shot in the other, that's perfectly fine. There's nothing wrong with that at all.
The CDC recommends flu shots for everyone 6 months and older, with a few exceptions. The agency says September and October are generally good times to be vaccinated, and ideally everyone should be vaccinated by the end of October.
People who smoke cigarettes have a greater risk of COVID-19 hospitalizations and death. A new study looked at more than 400,000 people who battled the virus and found that people who currently smoke and get COVID are 80% more likely to be hospitalized. They're also at a much higher risk of dying from the virus. Researchers did say that current smokers are not at higher risk of facing a confirmed COVID infection.